do my project on hemophilia, intro, etiology, demographics, anatomy, physiology and symptoms, diagnosis and treatment. Etiology. In hemophilia, there are two main types that are found on the X chromosome. While hemophilia C is an autosomal disorder, the two main types are hemophilia A and hemophilia B. An autosomal disorder means it's not located on one of the sex chromosomes. There was a mutation that happened. Hemophilia is also a rare disorder that causes uncontrollable and prolonged bleeding. Hemophilia A is found on the F8 or factor 8 gene and is recessive. Demographics. About 33,000 males in the United States are estimated to have hemophilia. And hemophilia A is about 3 to 4 times as common as hemophilia B. And about 4 in 10 males have the more severe form of hemophilia in the United States. The more severe form meaning like hemophilia A, a severe version of that, or hemophilia B, a severe version of that. In the world, it ranges between 200,000 to 1.1 million people living with some kind of or some form of hemophilia. And according to a study, about 18% of mild cases are female and less than 1% of them are severe cases. Hemophilia typically affects white and Hispanic patients, while hemophilia C affects Ashkenazi Jews usually. Anatomy. In mild hemophilia, it takes a major trauma or surgery to be noticed, and the blood clotting level or factor activity has to be over 5% or over 5 to 40%. In moderate hemophilia, it usually takes trauma, an injury, dental work, or surgery, and the blood clotting level is between 1 to 5%. In severe hemophilia, however, the bleeding is spontaneous. People with severe hemophilia typically have internal bleeds. Joint bleeds are common, typically in the knee. Bleeding in the brain, throat, or abdomen region required medical attention immediately. And it's noticeable at a young age as well. And it typically affects everything depending on how severe it is. For the musculoskeletal system, joints are commonly affected. They're causing swelling, damage, and stiffness. Arthritis can also occur. For the muscles and soft tissue, they can come down with compartment syndrome or pressure buildup. In the central nervous system, there's an intracranial hemorrhage, better known as a brain bleed. In the gastrointestinal tract or the GI tract, you can have abdominal pain, blood in the stool, or vomiting blood. And in the kidneys, it's typically blood in the urine. So, like I said, it just depends on the severity, but it affects everything. Physiology and symptoms. In hemophilia, it is caused by a protein deficiency in the F8 or F9 gene, like I said previously, causing prolonged bleeding after minor trauma or even spontaneously. Large bruising from minor injuries is typically a sign, and it is caused by mutation that provides information for making the clotting factor, as I once said. If untreated, joints can go through painful arthritis and deformities. Swelling can increase pressure on nerves and tissue, causing damage in the muscles. Small bleeds in the brain can be life-threatening and can lead to death if not treated. Blood and urine or stool as well, and life expectancy has improved to around 57 years old with severe hemophilia. Diagnosis and treatment. In hemophilia is typically diagnosed at an early age due to people in their families having family members that have it, and it's typically diagnosed around 6 months for most people. It's the most common 2 tests are screen testing and clotting factor test. For severe hemophilia, the main treatment involves replacing the clotting factor, and it uses and it's used to treat a bleeding episode or to help prevent an incoming episode or bleeding episodes. People with severe hemophilia may have a negative reaction to the clotting factors used to treat the bleeding. As the proteins develop in the immune system, that makes the treatment less effective. There is also no cure at the moment, but so far gene therapy and Roctavan and Hemgenics can help prevent bleeding. And thank you for your time.